Cuomo's vaccine rollout is controlled by the woke left. Critics blast New York governor for revealing drug addicts in rehab will get the COVID vaccine before elderly residents. The governor of New York, Cuomo, has been criticized over his planned rollout of the vaccine. It would prioritize drug addicts ahead of elderly populations. He explained that they would be prioritized because many of them live in problematic shared accommodation. One commenter said the rollout was being determined by the woke left. Rep. Elise Stefanik called Cuomo an absolute disgrace. Cuomo's spokesperson has insisted that nursing home residents are still being prioritized and will be receiving the vaccine. Well, that's good to know that they're being prioritized somewhere along the totem pole and that Cuomo isn't actively seeking out ways to try to kill them. Or maybe this goes along with his thing from earlier in the year where he put sick patients into nursing homes. So another slap in the face for the elderly, I guess. Office of Addiction Services and Supports said drug users are being stigmatized. Those at high risk of COVID should be vaccinated in line with other high-risk populations. Old people. That's all I have to say is old people. Old people, old people, old people, all day, every day. That's all I've ever said. If you look at the numbers, it dictates where we should start off. People want to talk about race, gender, all this nonsense. Old people first is what I've always said. Get the old people first, kind of cast that net as wide as possible. That was kind of like the analogy I used. And then obviously you work your way down. And I said the fight was going to happen. It's just the nature of things. It's, as we've seen with the lockdowns and masks and everything, people have their different ideologies on how things should go. And it's all about having a position of higher power for you to kind of dictate to others what your beliefs are about this. We see this, like I said, with certain governors locking down. Some aren't. Individual stances on the vaccinations, priority, the CDC issuing some kind of race-based guidelines. It's all about who's in power and what their mindset is in terms of who gets the stuff. It's one crappy fight. Now, regarding that comment about the woke left as it pertains to Cuomo, the comment was made by the publisher of a politically conservative online magazine, the Federalist's Domenech, who is unhappy that drug addicts will be prioritized over the elderly. And obviously there's a lot to say about that. I donate to some charities that help individuals that are struggling, homeless individuals as well. There is something definitely to be said about individuals who willingly put themselves at risk, who willingly create risk in their life, be that drugs, diet, other risky behaviors that one can take on. Individuals that willingly take on the risk or create risk in their lives to now reward them in a way. Now, I get it. We look at these populations and we say, oh, well, they're statistically more likely to get this because of X, Y, and Z. And yeah, I certainly get it. But it's hard to reward. Again, we're not saying that a reward in a traditional sense. It's a tough sell to tell people that you're going to give something to somebody that's putting themselves in harm's way. Say there was some overweight person who's eating themselves to death because of body negativity, and they're standing next to me and I exercise, I'm doing what I can do to try to stay healthy, and they have the comorbidities, they have all the risk factors, but they brought that upon themselves. Who gets the shot first? I mean, that's just the reality of things. You know, it's the weak will want to assist the weak. The weak will think one way about it. The strong will think another way about it. Now, it's unfortunate. That's the main thing, is it's unfortunate that it has come to this, but it makes you wonder, right? They say that there were going to be 20 million doses available by the end of the year. Not 20 million people injected, like the media likes to try to mince words and make stuff up. But there would be 20 million vaccination doses available, are the words that came out of people's mouths. And we're only at about 2 million-ish at the time I'm recording this on Wednesday night, the 30th. And I read somewhere there's over 12 million doses available. It's probably more by now, but if there's so many vaccinations out there, why do we even have to prioritize? I know that they're not all right there in the city, but if a lot of people aren't taking them, which seems to be the case, that so many are available but hardly anybody's taking it, why is there a fight? It seems like it should be a situation that everybody who wants one should be able to get one. Currently, after those in urgent care, along with doctors and nurses administering the 19 vaccine, shots are given to the residents of drug rehab centers, ahead of the state's elderly population. Okay, so good. Urgent care is getting it, doctors, nurses getting it. Nice. The debate is obviously drug rehab centers versus the state's elderly population. Don't kill grandma! Cuomo, he will come for your grandma and he'll come for your grandpa. He's done it before. Cuomo faced fierce criticism after more than 6,600 nursing home residents in New York died from CV during the height of the pandemic. The true number of deaths could be anywhere up to 11,000, according to an AP analysis, as healthcare officials only counted residents who died on site and not later in hospitals or other facilities. A Justice Department inquiry is underway that could determine whether New York is undercounting CV deaths among the elderly in nursing homes. This guy willingly killed people. We're not just saying out of some fluke or something like he didn't know or, you put sick people in with old people. What did you think was going to happen? And they gave him prizes about it. People even called this guy a great governor. I was scrolling through, read some of the tweets below. People call this guy a great governor. Let's take a look at those tweets. The worst governor in America streak continues, this time prioritizing vaccines for drug addicts over tens of thousands of seniors who have been homebound since the start of the pandemic. An absolute disgrace. And this is that Elise Stefanik individual referred to. Stefanik is probably how it's pronounced. Referenced earlier in the article. Here's some numbers here. New York is expected to receive 259,000 doses of Pfizer, BioNTech, and Moderna vaccines this week. I love the Daily Mail. Rep. Elise Stefanik also slammed Cuomo in a tweet earlier this week, proclaiming him to be the worst governor in America for prioritizing vaccines for drug addicts over seniors. It's too bad that in this day and age, there are still people who refuse to think of addiction as a health issue and choose to stigmatize. Okay. Group living. They should definitely get vaccinated. Are you saying they aren't worth it? But see, here's where she's a dipshit. Nobody's saying they shouldn't get vaccinated. We're just talking about the pecking order. But then plays the old typical line, are you saying they aren't worth it? So then basically here, the reply would be, okay, well, if they're more worth it, then what about all those old folks in New York State? See? That's where a Nimrod like that isn't smart enough to think through everything. Kimberly Forsyth, a New World optimist, like her hat by the way. Hey Kimberly, if you're watching this. Classic ethics question. Should you let the train hit the kid or the senior? What is a disgrace is that we are so unprepared for this inevitable occurrence that we didn't have a plan. So I think he made the right call. If you can't see this, you're not thinking like a leader. It seemed like she was going down the right path. I was with her when she was talking about unpreparedness and it being inevitable. And then she comes with that in the end. We disagree. And that's what I said. That's how it is when you have differences of opinion in individuals with institutional power. So somebody like myself or Kimberly, we have no power. She is going to choose drug addicts who put themselves in that position over senior citizens who are doing nothing wrong. Me, I would choose the great senior citizens of New York State. The people that are just out there minding their own business and have these super high death rates. Now, don't get me wrong. The death rates for drug addicts and stuff like that, they may be high. I haven't seen the numbers. As I said, though, I think if you start age-based and work your way back, you sweep up as many people as possible. And that's everywhere. That's gender, race, and anything like that related as well. Sick individuals, the drug addicts, and good old granny just sitting at home baking cookies, wondering when she's going to get to see her grandkids again. I think what she is saying is the vaccine should go to politicians and then the wealthy. After that, let it trickle down, kind of like their tax plans. Again, another genius right there. You have people out here, like this individual Dan, that are so stupid that they think that somebody saying that old people should get it first, that he's taking a political jab, that their tax plans, in spite of the numbers that have been proven, despite what the media says and how they lied to people, in spite of what the actual result of the Trump tax cuts, he's so stupid that he still believes what the media tells him. We'll see what happens when Biden lets the Trump tax cuts expire, and we'll see what he's talking about after that. He's probably so stupid he won't even notice. He'll just eat everything up that they tell him. To suggest that this is all about politicians and the wealthy when she's merely talking about senior citizens, it just tells you the stupidity of some people out there. More comments here, more hate for her. Ha ha! Woo! I'm sure there's some positive ones. They probably just elected not to put those up here. Now here's somebody who says, I dispute your characterization as Cuomo is the worst governor in the U.S. I think Newsom of California nailed the title some time ago. A lot of people would disagree. I think the individuals in Michigan would have a gripe. Some individuals in Oregon would have a gripe. Some individuals in Washington State would have a gripe. However, some individuals in those states probably swear by their governor. There's probably people out there that love Gavin Newsom. They swear he's the greatest governor ever doing the best job. And then one more moron here. Best governor in the country, says of Cuomo. That's what I was talking about. You, however, back Trump, saying COVID is a hoax. Again, that wasn't said. It's just individuals who kind of parrot what they're told to parrot by the media. Unfortunately, there continues to be a stigma against those in recovery when it comes to equal access to health care. These individuals deserve the same access to medical care as everyone else, and those at high risk of COVID should be vaccinated in line with other high-risk populations. And like I said, the death rates for individuals over 70 are what they are. If you're under 70, and even more so under 60, and you get this, chances are you're living. But if you're over 70, then you are super high risk. So there can't be that many 70-year-olds out there across the U.S. to where they can't incorporate them into this with their other high-risk populations. And to say they deserve the same access, you're not giving them the same access. You're giving them more access. You're saying, sorry, Granny, sorry, Grandpa, this addict is getting better medical care than you. They get to cut to the front of the line. Now, as I said, their numbers may be high as well. Lump everybody together then. But that's the thing, you know, like I was talking about earlier, we go back and forth, and it's always a one or the other kind of thing. And that's why I saw this coming months beforehand, months before the vaccinations were even ready. I knew that it was going to get to race at some point, to gender at some point, and that individuals were going to be given preference. It's just how it is. It's not like I know, it's not like I had a magic crystal ball, magic 8-ball even, but it's just the nature of things. And what I alluded to earlier is when there's such a kind of like a partisan divide, it's always going to be about who has institutional power, as I said, that can force their beliefs upon those constituents they reside over. So in this case, Cuomo, New York, he feels a certain way. He wants it done a certain way. I haven't seen the statistics to back up the addicts and everything like that, but even if the numbers didn't dictate that, if that's what he wanted, that's what he would do because he has the power to do so. Whereas I said, me and the other people that are tweeting, we're just kind of hanging out. That being said, make a resolution to yourself to go out and exercise. Try to be as healthy as possible because as you can see here, they're going to try to dick you over. They're going to try to play favorites. Sometimes it makes sense, sometimes it may not. Don't let how somebody else perceives you based on any of your characteristics. That's your health, that's your race, your height, your gender, anything like that. Don't let somebody else in power be able to dictate to you what your access to medical care is. So take care, everybody. Thanks for watching. Be well. Have a good new year and be safe out there.